I'm Richard O'Brien. I'm former Dean of the Creighton University School of Medicine, former Vice President for Health Sciences at Creighton, and currently a member of the Center for Health Policy and Ethics at Creighton. We hear it often said that U.S. healthcare is the best in the world, and I'm sorry to tell you that simply is not true. Literally tens of thousands of Americans die every year from medical errors, from preventable infections, and from lack of access to timely care when it's needed, either because they lack insurance or they live in areas where they don't have access to health professionals because of shortages. Of all the developed nations in the world, the U.S. ranks in the lowest third in its healthcare outcomes. And we get this flawed system at the highest cost of any nation in the world. Our system costs 50% more than the next most expensive nation. And costs are rising incredibly rapidly, and we leave uninsured 50 million people and underinsured some 25 million people. Americans are very concerned about health care. They're primarily concerned about costs. They're concerned about the loss of coverage. And they want change. Americans want health care to change today. There have been many efforts to reform health care over the last century, starting with Theodore Roosevelt. Presidents Truman, Nixon, Johnson, and Clinton all had major health care reform initiatives. All failed, save Johnson, who was only partially successful in being able to get enacted Medicare and Medicaid. This system, as we know it today, is unsustainable, and an unsustainable system must be changed. There is reason for hope, I think, now, because it's become President Obama's highest domestic priority, and it's also a high priority for many Democrats and Republicans in the Congress. And they're trying to work out compromises, but they're encountering conflicts of interest from people who profit significantly from the system, and people who are fearful of losing something, from ideologic conflicts between those who believe that market is the solution to all problems and those who believe that when it comes to a social good, the government has a central and crucial role in assisting people achieve access to that good. And then, of course, there are those who just want to see President Obama and the Democrat-controlled Congress fail. It is high time we put behind us these conflicts and work out compromises that we can all live with. We cannot wait for this system to collapse. We must reform health care now. If we wait for this system to collapse, it will make the financial system collapse look like peanuts, and rescuing a collapsed health care system will be desperately more difficult than rescuing a collapsed financial industries system.